When you think of October, you probably think of fall and Halloween, but you might also think of Pink and Breast Cancer Awareness Month. And as this month comes to an end next week, we're learning more about how this disease impacts women and even some men here in Eastern North Carolina. I sat down with Dr. Corinne Chambers from ECU Health. She shares how she's helping people here in our area and how you can also stay on top of it. Talk about just here in Eastern North Carolina, kind of like the prevalence that we're seeing with breast cancer, maybe nationwide, statewide, and then even locally if we have some of those numbers.
Absolutely, sure. So overall, the rate of breast cancer is 1 in 8 women will be diagnosed with breast cancer, and I think that holds true here. Our population tends to side on a little more of the African American patient population, which can be prone to a little more aggressive subtypes of breast cancer. But we do our best to take care of those and catch those early. That's why I encourage screening yearly after the age of 40 to try to make sure if we're going to find something that we catch it as early as we can.
You mentioned the 40 mark. Is that kind of typical?
That is kind of a standard recommendation right now from a few different groups, starting annual mammography at the age of 40. But that is for average risk women, just to be clear, because if you are at high risk for breast cancer, you fall into a different category and should be screened appropriately.
What are those high risk?
When you have a family history of breast cancer, and we use mathematical models to quantify a patient's risk, and that is classified as over 20% lifetime risk for breast cancer in the future.
Talk about, just some signs and symptoms for women. I know we hear a lot about just breast cancer awareness, but what does that kind of mean in the day-to-day life?
Absolutely. So I think we start with screening because we want to catch it before it's something clinically apparent, something before you feel it or before you have symptoms associated with it. But if you're going to develop symptoms related to breast cancer, I would look for a new breast lump that kind of feels firm, pretty immobile in that breast tissue, tends to be growing with time. If it gets more advanced, you can see signs like skin changes or very superficial rashes to locally advanced breast cancers, which erode through the skin and actually form kind of a very ugly appearing non-healing wound. And so that can be, unfortunately, the first sign of cancer for some of the patients that come in to see me.
If women do see something like this or catch something early, what should they do?
I would first seek the help of their physician, and often that's the primary care physician, but we do accept self-referrals in our breast care center, so if we feel like we're not getting taken care of appropriately, we will get you taken care of.
Are there any other tips or guidance or anything else you would maybe want to share with the women of Eastern North Carolina?
The women of Eastern North Carolina, get their screening mammograms, get checked, make sure they're communicating with their physicians about their concerns. I want to make sure women and men who can develop breast cancer understand that it is treatable and oftentimes curable. And I say this in the office all the time. I don't use the word curable lightly. So when I say curable, I mean curable. And if we can catch it early, we have the resources for them to do very well with minimal surgery, minimal treatment paradigms. And some of the patients' biggest fear is chemotherapy. And I often find myself saying, chemotherapy for breast cancer is maybe not as aggressive and not as ill-tolerated as other chemotherapies. So the treatments and the process of getting care for breast cancer is much more fear-evoking than it really hopefully needs to be, because we can get this treated and oftentimes get it cured.
And to listen to my full sit-down interview with Dr. Chambers and hear more about what you can do to lower your risk, you can visit our website, WNCT.com.